Hello, fellow weight loss patients. Jane here, reporting in from Sydney, Australia, and just an update. A little bit late, my 3-week post-op. So, start off with some stats. My starting weight was 88 kilos. My op weight was 85.9 kilos, and my current weight this morning was 80 kilos. Last week, I was 82.2. So that was at 2 weeks. So it's kind of really slowed down. I'm like around 79, 80 for the past week. But so it's only 8.2 kilos over a week and a half, which is still good, and it's going down, but can't seem to get away from this 80, 79, 80 kind of mark. But the nutritionist I saw this week, and she said that that's perfectly normal to have a plateau, and then it'll start dropping again, and then as you're going through, there'll be plateaus. So hopefully we'll start to see some decreases soon. I really wanted to get into the 70s because it's always the hard bit for me to get from the 80 kilos mark into the 70s. And getting below 75 is always like huge. If I can get below 75, it'll be the least that I've weighed in probably 15 years. So, or maybe 10 years. But so that'll be really good if I can get there soon. What else has been happening this week? So after being at the nutritionist, so I know I'm now on mashed foods. So I'm trying to get used to that. So I've started having protein smoothies in the morning to get my protein in. So basically a banana, an Opti Slim or OptiFast sachet, a couple of teaspoons of Benefiber, and 2 scoops of protein powder. So that gives me 40 grams of protein right there in the morning. And then I've made up some mashed potato and mashed roasted pumpkin and sweet potato with garlic. And I've been having that with a little bit of Greek yogurt. May sound weird, but it tastes really good. That's what I've been having pretty much for my lunches at work. It takes me probably about an hour to get through half a cup, so I'm just eating really slowly. I get about 2 to 3 teaspoons in at a time, and then I have to take a little bit of a break. I'm able to drink heaps more water now, so I'm getting at least a litre of water per day, sometimes a litre and a half. So that's really, really good. I still feel thirsty most of the time though, but I think that's because I've still got the diet cordial in there, and that sweetness. I'm just not used to drinking sugary drinks all day long. That sweetness kind of makes me thirsty, I think. I think that's what it is. What else has happened this week? I went to see the surgeon for my first post-op meeting. So that was Dr. Clement Sang. Pretty basic meeting. Just asked a couple of questions about how much exercise I can do at the moment. He's told me to wait 6 weeks before I do any kind of core or stomach exercise, but walking is fine. I should be doing plenty of walking, so trying to get that in every day, taking the dog for a walk, shopping. It's exercise, walking around. But he also said I can start hand weights as well. And I can do some leg stuff as long as it doesn't include the core. I asked about swimming because it's getting hotter. And he said no, because swimming uses your core. So Wet and Wild is out for tomorrow. Because even like going down water slides, I mean, you're holding on, so you're using your core, unfortunately. But I can go in the water, he said. So I can go into the pool and get wet at least, just not like full on swimming, but I can wade around kind of thing. Still got a bit more energy again this week. It lulled a bit the end of last week, but it's picking up again. I've been busy all day today. I did some more gardening this morning, and went and did a bit of shopping, and then I made mulberry jam from the mulberries on my tree this afternoon. And gonna try and make peach chutney tomorrow if I get time. Really, it's been a quiet week, busy at work. So I've got a little bit of a clip from work, driving at work, that I'll put in here somewhere.
So it was my first day back at work today, just on my way home. Main thing that happened to me today is I vomited twice. It's the first time since I had my surgery that I have vomited. So I was a little bit apprehensive because I've heard some bad things, but actually there was no pain. I was just yucky because it was vomiting, the way that vomiting is not nice anyway. So the only thing I can think of that might have caused it is that for the first time today I had my normal multivitamin, and then I had hair, skin and nails multivitamin, like especially for that multivitamin after it, and that's when I started to feel sick not long after the hair, skin and nails one. So won't be trying that one for a while, maybe only if I need it, but hopefully I won't lose my hair. Anyway, that's that for now. Talk to you later. Bye.
One of the things that did happen, actually the day after I went and saw the surgeon, because I asked him about my dressings on my wounds, and he said, "Oh, you should have taken them off already. You're only supposed to keep them on for 10 days." I said, "Well, the nurses at the hospital told me I had to keep them on until I saw him after 2 weeks." So he didn't offer to take them off for me, but I took them off when I got home. Everything seemed fine. All the wounds seemed okay. The next day, one of the wounds opened up, and by that, like, not full on, there was no bleeding or anything like that. I just noticed when I got home that it was open a little bit and it looked a little bit angry. So went to the doctor, and she agreed with me. Took a swab, and I'm on antibiotics to get rid of any infection, and I've put a waterproof hospital dressing back on it. All the other wounds seem fine. I've been putting bio oil on them so they don't scar, but they're really tiny, apart from one which is about that long. That's the biggest scar that I've got the biggest incision that I've got so far. So yeah, really rubbing the bio oil, hoping it doesn't turn into a scar. And that's probably it, really. Nothing else really to report this week. I hope everybody else is going really well. If you have any questions, don't hesitate to ask, and I'll see you at week 4. Bye bye.